Hi, yeah, as Rory said, my name is James Morrison. I work in the People and Places team at the RSA, and the work I'm about to present emerged from a project we ran looking at the economic security of people with multiple long-term conditions. For context, 2 weeks ago, the Chancellor gave a spring statement that aimed to ease the cost of living crisis and improve the economic security of people in the UK. And in addition to some tax cuts, he expressed concern over 420,000 more inactive workers of working age in the 3 months to January than there were in the 3 months to February 2020. The main driver being the rise in people who are long-term sick. And yeah, so to improve outcomes among this group, Rishi Sunak that the government has dedicated £1.1 billion worth of funding over the spending review 2021 period to specialised disability employment support, including £156 million for additional work courses for claimants of incapacity benefits, and that was the only support that he mentioned. So this, based on research, we find this is indicative of the current approach to supporting people with long-term health conditions. And this focus is largely on work-based routes to financial stability. However, it disregards that millions of people are unable to work as a result of their health. And so tax cuts don't help this group, and work coaches will be unable to resolve their health issues. So our research has found that people with long-term health conditions who are unable to work have some of the lowest economic security, and almost 2/3 of those out of work due to sickness have low economic security. And yeah, we find these kind of back to work policies have little impact on this. So when the RSA began researching the economic conditions of people with health conditions, we didn't want to kind of replicate that kind of work-oriented approach. So to take a more holistic approach, we used the notion of economic security, which Rishi Sunak kind of also used, but we're kind of understanding it in a different way. And we define it as the degree of confidence that a person can have in maintaining a decent quality of life now and in the future, given their economic, financial, and social capital. And this is intended to be a holistic and experiential understanding of the factors that affect one's economic circumstances, and including but not limited to income, savings, wealth, working conditions, housing tenure, and health status. And this wider project kind of emerged, and it was kind of focused on an understanding of the economic security of people with health conditions. And it was based on a framework established by one of our funders, which was Impact on Urban Health. And it's based around people who have 2 or more of the health conditions that are on screen now. So we adapted these conditions according to the data available in Understanding Society. And then in this work, we defined multiple long-term conditions as people who had 2 or more of the 20 long-term conditions listed in the Wave 10 main stage. So we also defined people's economic security level by combining their responses to 2 questions, which ask for the respondents' subjective assessment of their current financial security and that in a year's time. So using this, we found that 33% of people with multiple long-term conditions are currently kind of economically insecure. And we also found that 1 in 3 working age people with multiple long-term conditions are in receipt of multiple benefits. And that's compared with 10% of people who don't have any long-term conditions. In addition to that, we found that 1/4 of working age people with multiple long-term conditions are out of work due to long-term sickness or disability. That was the kind of group that Chancellor kind of raised his concerns about. So kind of when we'd kind of done this kind of initial analysis, it seemed clear to us that the kind of typical path to economic security to work would not in fact work for a lot of these people. And so that kind of formed part of our research. But then we also wanted to look at whether work actually provided security for people who had long-term health conditions but who were able to remain in employment. Which led us to our research question, which is what is the impact of a first health condition diagnosis on income growth for those who remain in work following a diagnosis? And our hypothesis was that all people who were diagnosed with a new health condition and remained in work would experience significantly lower income growth in subsequent years. And so there's a lot of kind of literature that already exists on the relationship between disability and work. And I think a lot of this kind of focus on the kind of different rates of employment and the income gap, but this is kind of tended to focus on absolute income figures. So we kind of wanted to look at kind of income growth rather than just the kind of raw differences. And we also found that using long-term conditions in general in this project, using Understanding Society, was really beneficial because it kind of offers something a little bit more objective in a way of diagnosed conditions and isn't dependent on any perceptive impact, which can sometimes be an issue when just using the kind of term disability. And we also found it really valuable that we could chart the impact of additional diagnoses. So to kind of address that research question, we analysed the gross labour income of respondents over the 10 waves of data. So we focused just on participants who'd responded to 2 consecutive waves and created a flag to kind of indicate whether the participant had had a new diagnosis of the first health condition since the previous wave. So there was a bit of a difference in how some of the health conditions were recorded wave to wave. So we weren't able to actually chart the kind of impact of additional diagnosis, as we had to use the kind of health variable, which is just asking whether someone has a long-standing physical or mental impairment, disability or illness. So having done this, we then calculate the change in gross labour income of respondents. And then we kind of calculate the average income change up to 8 preceding waves before a diagnosis, and then doing the same with the up to 8 waves following a diagnosis. And we were then able to find the difference in income growth before and after diagnosis, and then consider the differences by, for example, gender or economic security level. As I mentioned, there was a bit of a limitation in terms of how we were able to do it. So when we did our cross-sectional analysis, we looked at people that had 1 or more multiple long-term conditions, and we consistently found that people who had multiple long-term conditions had worse economic outcome than those who just had 1. But we weren't able to kind of track the same changes because there was this difference in how respondents were asked about their health conditions. To give a quick summary, so basically in wave 1, respondents were asked if a doctor had ever told you that you have any of the health conditions listed, and they could choose from 17 options, and they were also asked if they still have that condition. So in wave 2, respondents were asked if they'd been diagnosed with a new health condition since the last wave, but new entrants were not asked about their health conditions. So following on from that, new entrants were asked the same questions in wave 1, but we kind of found it was really, we couldn't find a way to establish baseline figures for health conditions for respondents who entered in wave 2. We found we were kind of unable to reliably track multiple long-term conditions over the waves. So this was a little bit less precise than we would have liked, but I think overall we were kind of still able to kind of find some significant results. I think in future it would be beneficial for researchers looking at health conditions if there was a bit more, if the kind of current standard was maintained, because we found it to be really beneficial in the current way. So at the population level, our hypothesis was correct, and people who were diagnosed with the first health condition and remained in work experienced significantly lower income growth than those who did not receive such a diagnosis. And across 10 waves of data, the increase in average annual labour income of those with a newly diagnosed health condition was £640. In contrast, those who remained without health conditions saw their income increased by £991, and those who continued to have a health condition saw their labour income increased by just £391. So over, say, a 5-year period following a diagnosis, this would equate to a kind of lost income growth of almost £3,000, which obviously that compounds and worsens the economic conditions of those people with health conditions. And within this, we can see significant difference in the role that gender plays. In the year following a first diagnosis, men see on average a fall in income growth of just £231, which is not significant. In contrast, women who remain in work see an immediate and significant fall of income growth of £464. Yeah, and in subsequent years, both men and women follow the overall trend and see declines of £734 and £457 respectively. And for each person who received a new health condition diagnosis, we calculated the average income change in the years preceding and following diagnosis. The average income change prior to diagnosis was £1,418 compared to £669 after a diagnosis, which represents a difference of almost £750. So we also looked at the kind of median income of people preceding a new health condition, and we found that was £30,818. And so following diagnosis, the median labour income fell to just under £26,000, which kind of represents a fall of almost £5,000. And that's about 16%. It should be noted that within these figures, the kind of figures for prior to diagnosis includes those who left work after diagnosis, so it's not an exactly representative split. So though a new health condition diagnosis is associated with this immediate drop in income growth, we didn't find a corresponding fall in subjective economic security level, which is the thing that I explained before. Across our analysis of different groups, we found the proportion of people experiencing a change in economic security wave on wave is about 40%. And that's no different for people who have a newly diagnosed health condition. The proportion of people with a newly diagnosed health condition who experience a fall in economic security is not significantly different to those who remain free of health conditions. And the same figure, the same thing holds for the people 2 waves on. And this indicates the large disparities in economic security that we found in our cross-sectional analysis of wave 10 data is the result of like a gradual decline rather than anything more precipitous. This is kind of supported by the findings around income growth, where we kind of interpret the small but significant declines compounding to cause wider issues in economic security later on. So our findings illustrate that work doesn't really work for those at most risk of economic security. And though the economic picture for people with one or multiple long-term conditions is generally worse than those who remain in work, we wanted to spotlight this group. And I think that focusing on people whose work is affected by means outside of their control demonstrates the inability of the kind of work-orientated policies to improving everyone's security that I kind of mentioned earlier. But in light of these findings and others that informed our work cross-sectional analysis, we developed a number of policy recommendations that we believe would kind of rectify the present imbalance. And these are to provide tailored support on economic security for those managing a long-term condition diagnosis through kind of integrated care systems in partnership with local authorities and job centres and other stakeholders. And together they should establish local economic security hubs, which should include kind of key workers for people managing a diagnosis and operate on a subscription model. We also call for the support of people's needs, for particularly the needs of people with multiple long-term conditions in work, and expand the suitability of employment options for those looking for work. And that local authorities should encourage employers to specifically support those living with long-term conditions with a commitment to health inclusivity for employers. And that the Department for Work and Pensions should create a safety net that better supports people's living with long-term conditions by reforming universal credit, housing benefit and carers allowance, including a reversal to the cut for the £20 universal credit uplift. And finally, more expansively, with a view to exploring a new model of state support based on stabilising incomes and building security in the future. Local authorities, with support from the national government, should explore a UBI trial with a specific focus on health and well-being outcomes, and for those living with multiple long-term conditions. And I think in England that would be the first of its kind. And of course, we're also closely following the UBI trial set to launch in Wales in the summer, in which care leavers would be entitled to £1,600 a month for up to 2 years. And we anticipate that trial will provide much needed economic security during a difficult transition period in young people's lives. And other RSA were also involved in a multi-partner project looking at the health case for UBI. And as part of that, we currently have some really exciting early results that indicate a UBI would have a really strong impact on young people's mental health and kind of health more generally. And this is starting to kind of build that evidence base for the kind of wider impacts for UBI. And we think that the same positive results would be seen among people with long-term conditions. And as a third sector organisation, we found Understanding Society to be a really valuable resource, and we've continued to use it in other projects. But I'm not sure kind of how widely it is used among third sector organisations. So we kind of made these 2 data recommendations that apply as much to within our own organisation as for others, which is to utilise Understanding Society's ability to centre people's experience of their own economic reality, and then to build upon the measurement of economic security in the current external context of the cost of living crisis. And just to conclude, going back to the kind of spring statement I opened with, Rishi Sunak kind of stated that he thinks that individuals spend their money better than governments do, and that kind of individual approach to building economic security is the government's vision, and our research on economic security really doesn't support that. And I think in particular we found that policies aimed at working people will exclude many of the most economically insecure in society. And based on our work, we argue that economic security is not just having a bit more money at the end of the month, but it's also just to be in the position to live a fulfilling life with well-paid, good quality work and access to public services and education opportunities, as well as having a comprehensive safety net in the event of crisis. I think that's necessarily more expansive than the individual responsibility of building resilience, which combines strong sense of autonomy over one's life with the security afforded by good public services. Thanks very much for your time. Any questions, welcome to the chat.